CF, or cystic fibrosis, is a progressive genetic disease that causes persistent lung infections and limits the ability to breathe over time. This is Julia. She is 12 years old and she has just reached middle age. Julia inherited a gene for cystic fibrosis from each of her parents. More than 30,000 people in the United States are living with cystic fibrosis. Here are some facts about cystic fibrosis. It is the most common lethal genetic disease in the United States. Every day, 2 children die from cystic fibrosis. It affects 1 of every 2,400 white children. It is inherited as an autosomal recessive, and it is passed on by 2 parents who are carriers but do not have cystic fibrosis. Cystic fibrosis is caused by a mutation in the gene cystic fibrosis transmembrane conductance regulator, also known as CFTR. It's located on chromosome number 7. The problem is there's a deletion of 3 nucleotides that code for the amino acid phenylalanine. In patients with cystic fibrosis, this amino acid is missing from the chain. CFTR is found in cells that line the lungs, the digestive tract, the sweat glands, and the urogenital system. Based on the location of CFTR, it should not be surprising that it affects the pancreas, the testes, and the lungs. So it affects 3 important processes: digestion, reproduction, and breathing. People with cystic fibrosis produce a thick mucus. This mucus clogs the respiratory passages, the reproductive structures, and the digestive enzymes. This thick mucus attracts a bacterium known as Pseudomonas, which stays once it enters the body of someone with cystic fibrosis. This is the lung of someone with Pseudomonas. Pseudomonas is flesh-colored. Symptoms of cystic fibrosis would include sweat that tastes salty, frequent respiratory infections, difficulty breathing including wheezing and shortness of breath, difficulty keeping on weight, clubbed fingers and toes, and you can see clubbed fingers in the picture to the right, a barrel-shaped chest, frequent greasy stools, ascites, and male infertility. You can see in both the diagram and the picture the appearance of a barrel-shaped chest. The term barrel chest describes a rounded, bulging chest that resembles the shape of a barrel. Barrel chest is not a disease, but it may indicate an underlying condition like cystic fibrosis. The term ascites refers to the abnormal accumulation of fluid in the abdominal cavity, also known as the peritoneal cavity. The treatments for cystic fibrosis include mucomist, postural drainage or vest, antibiotics, and Viacase, and we'll talk about each of these on the next slide. Mucomist is the brand named for acetylcysteine. Acetylcysteine is a chemical that's inhaled by patients with cystic fibrosis to help thin their very thick mucus and make it easier to dislodge. Postural drainage is when the patient is turned in different directions to help dislodge the thick mucus. More recently, a vest that vibrates is used instead. So first the patient will use mucomist to thin the mucus, and then second they'll use either postural drainage or they'll use this vest that vibrates. Most cystic fibrosis patients need antibiotics because of the presence of the bacterium Pseudomonas. And then finally, Viacase, which is a tablet or pill that's taken orally by a patient with cystic fibrosis. It contains pancreatic enzymes like lipase, protease, and amylase to help these patients digest their food more readily. The most common test for cystic fibrosis is the sweat test. It's used because it's simple, it's painless, and it measures the amount of salt in the child's sweat. Is there a cure for cystic fibrosis? And the short answer is no, there is not. Read this information on the slide. I think you'll find it very informative. Great Strides is the name of the Cystic Fibrosis Foundation. Their motto is Lace Up, Walk, and Cure Cystic Fibrosis.